The government of Mongolia has announced a series of austerity measures in response to declining revenues from mining exports, particularly coal. As global coal prices fall, the impact on the national economy has been significant. However, the government has pledged not to pass this burden on to the public and instead has committed to reducing its own expenditures. At Wednesday's cabinet meeting, it was announced that budget funds will no longer be used to organize conferences and meetings. Furthermore, foreign travel expenses will be cut, and government positions with overlapping functions will be streamlined to increase efficiency and reduce redundancy. The government is transitioning to a more efficient system, much like upgrading the engine of a car to an ecosystem. We have decided to reduce the overall number of structural units in ministries by 31%. For example, there are currently 138 departments across 16 ministries, which will be reduced to 109. The number of internal divisions within ministries will be cut from 132 to 77. In total, the number of department and division heads will be reduced from 270 to 186. Due to limitations in using budget funds to finance new projects and programs, the government will instead focus on increasing foreign investment. This includes improving policy planning, strengthening the legal environment, reprioritizing current projects, accelerating urgent initiatives, and postponing non-essential projects to attract external funding. In cooperation with the Embassy of France, Mongolia successfully organized a training and practical exercise on the topic of providing general medical emergency care by helicopter. The event focused on enhancing participants' theoretical knowledge and practical skills in air medical rescue operations. Notably, attendees practiced patient transport and equipment landing procedures using the 111th Air Search and Rescue Unit of the General Department of Emergency Situations. There are 3 helicopters, like the one behind me. These helicopters are primarily used in emergency situations, such as wildfires. Additionally, over the past 3 years, they have conducted flights to more than 300 SUMs across 21 provinces to provide emergency medical assistance in coordination with this hospital. This training was held for the first time as part of the 60th anniversary of diplomatic relations between Mongolia and the Republic of France, and it was implemented within the framework of the bilateral financial agreement signed in 2019. Held from June 23rd to 25th, 2025, the training brought together over 100 officers and specialists from the Ministry of Health, major state hospitals, the Air Force Command of the Armed Forces, the General Department of Border Protection, the General Department of Emergency Situations, and representatives from the private sector. The training aimed to strengthen clinical techniques and align with modern trends in medical evacuation and air rescue, especially for critically ill or injured patients requiring urgent care and safe air transport. According to the General Department of Emergency Situations, in the past 3 years, emergency helicopters have conducted flights to all 21 provinces and over 300 SUMs, delivering urgent medical services to more than 1,200 individuals. These operations have provided timely medical assistance in cases such as traffic and domestic accidents. Previously, patient transport relied on Mi-171 helicopters operated in cooperation with the Armed Forces 303rd Unit, which were not specifically designed or equipped for medical purposes. Today, however, newly deployed helicopters are specially outfitted with modern emergency medical equipment and staffed by professional healthcare personnel, significantly improving patient outcomes and contributing to the protection of public health.
And I have been involved in mountain rescue and helicopter medical transport for 25 years. The first 2 days consisted of theoretical presentations in the amphitheater, where we shared and exchanged our French experience and expertise on helicopter-based emergency medical care, particularly the benefits it offers to patients. We are also considering the development of a more specialized training program that includes clinical case discussions focused on helicopter transport, such as the indications, contraindications, and safety protocols necessary for effective air rescue operations.
In accordance with the government's policy to support institutional kindergartens and ensure that no child is left behind closed doors without access to preschool education, Urgu Maternity Hospital has established a kindergarten for the children of its employees. Given the unpredictable nature of medical work, this initiative provides medical staff with the opportunity to concentrate on their professional duties without worrying about the care of their children. Our hospital has approximately 420 employees. According to a recent survey, around 70 of their children are between the ages of 1 and 5 and require kindergarten services. The kindergarten we opened today has a capacity for 50 children and will operate under kindergarten number 42 of Sukbatar district.
I am very pleased that Urgu Maternity Hospital is the first maternity hospital to operate a kindergarten with 50 places.